Happy morning, everyone. Welcome to Metier YouTube channel. After a long gap, again we started posting important MCQ for the upcoming NORCET exam. Recently, we got selected so many students from our Metier Academy in CRE examination, and congrats for all of them. Please start do the workout for this upcoming NORCET exams. So if you study from this day onwards, also you can crack the exams. So kindly follow our channel to get to know about the upcoming exams. Okay, we'll start today's session with a small quote. The world of the future is in our making. Tomorrow is now. So the world of future, that means your future is in your hand. You can make it with yourself. Think that tomorrow is now. Then only we can act very fastly in a brave manner with intelligence. Okay. நம்ம தான் உலகத்தை நாளைக்கான உலகத்தை நம்மளே உருவாக்கணும். ஓகேங்களா? நாளைக்கு இன்னைக்கு இருக்குன்னு நினைச்சுக்கிட்டு செயல்பட்டுக்கிட்டே இருங்க. கண்டிப்பா உங்களுக்கு வெற்றி தேடி வரும். Okay. So today we are going to see about a musculoskeletal system. Important MCQs on musculoskeletal system. We'll start the session. Okay. So first question, acromion process is located on where? Ilium, scapula, humerus, ulna. Very easy and basic question. Acromion process. So the correct answer is it is present in the scapula. You can see it here. This is the acromion process. This part is an acromion process. What is the role of this acromion process? It's very important part in the shoulder, which maintains the stability of the shoulder. That is the main part of the acromion, as well as it connects the scapula as well as the clavicle together. That is the main process of the acromion. So acromion is a bony projection on the scapula that is called a shoulder blade. Okay, plays a crucial role in the shoulder stability, muscle attachment, and articulation with the clavicle. That is collarbone. So what is other part? Ilium, you know, that is present in the pelvic bone. Humerus, and this is a humerus bone. And ulnar, it is in the hand. Okay. Okay, that's all about the first question. Second question, which of the following is not a part of mandible? So it's not a type of question. Okay, we have to select which is not related to the mandible. Those options are alveolar process, mental foramen, glabella, mental protuberance. So what is the correct answer? It's also a very easy basic question. It's a glabella. So when we see about the mandibular part, so many parts are there. So according to this question, so this is alveolar process, which is just below our teeth gums. Okay, the mandible, that is alveolar process. Next is mental foramina. There is a small hole which present in the mandible. So what is this purpose of this mental foramina? The mental nerves and some nerve fibers will pass us through that hole, this part. Okay. Next is mental protuberance. So we call it as a chin. This is called mental protuberance. That is chin. So where we can see the glabella? So glabella is a bony point located in the frontal bone. It in between the superciliary arches. I'll show the picture. It is called brow ridges. Okay, between the brow ridges, we have the glabella. You can see it here. This is glabella. This is two superior ciliary arch. We can palpate this superior ciliary arch. So this is glabella. In between that, the middle point, it is called glabella. Clear? Okay. The next question. Dash suture separates the large unpaired frontal bone from the two parietal bones. So nothing but they're asking about the sutures of skull. So the options coronal, sagittal, lambdoid, and frontal. So what are the sutures we have? We already know. So coronal suture, which separates the large frontal bone from the two parietal bone. So we have coronal suture. So let's see what are the sutures we have. So see, this is frontal bone. Okay. This is parietal bone. The question is asking frontal bone divided into two parietal bone, which is by the coronal suture. So What is the suture present in the frontal? It is called metopic suture or frontal suture. Frontal suture or metopic suture, which divides the frontal bone. Okay. And between frontal and parietal, we have coronal suture. This metopic and coronal and parietal, three sutures will form the anterior fontanelle, which closes at the age of 1.5 years, which is diamond in shape. So we have to correlate like this. Okay. So parietal bones, which divides the two parietal bone, and we have lambdoid suture, which present between the parietal and occipital bone. These two sutures will form the posterior fontanelle, which is triangular in shape, which closes at the age of 1.5 months. Clear? So according to this question, coronal suture, which separates the frontal and two parietal bones. Clear? Okay. Next question. Okay, which of the following is not a shoulder muscle? So actually speaking, the shoulder muscle have more 17 shoulder muscles are there. Okay. So the question is not a shoulder muscle. Deltoid, supraspinatus, teres minor, pectineus muscle. So the correct answer is D. Pectineus muscle. Pectineus muscle is not comes under a shoulder muscle. So apart from 17 shoulder muscles, the very important shoulder muscles are called rotator cuff muscles. What are they? Supraspinatus, infraspinatus, teres minor, and subscapularis. In laterally, we have deltoid muscles. Okay. These are the major muscles when compared to other 17 remaining muscles of shoulder. Okay. Supraspinatus, infraspinatus, teres minor, and we have subscapularis. And laterally, we have deltoid. What is pectineus muscle? Don't think that it's a pectoris, part of the pectoris chest muscle. It is a muscle in the lower limb. Okay, it's a flat quadrangular muscle which is situated on the anterior part of the thigh. Anterior and middle part of the thigh, it is called a pectineus muscle. So it is not a part of shoulder muscle. Okay. Next question. External occipital protuberance is also called what? So occiput, everybody knows it's back of your skull, right? It is occiput. So there is a protuberance. That protuberance means what? It's a small projection. That is called a protuberance. It is also called what? The options nasion, acromion, inion, dens. So the correct option is inion. Inion is a small protuberance that's present in the external occipital protuberance, otherwise called inion. So what is the purpose of this inion? When we measure the skull circumference or diameter, we have to keep that measuring tape on the inion only. In this level only, we have to measure the skull, right? Okay, that is the purpose of inion. What is nasion? That is, we have seen in the first question, right? Below the glabella, we have the nasion. So when we are measuring the skull, back, we have to measure it from the inion. In front, we have to measure it from the nasion. It's the main two anatomical part which helps to measure the circumference of the skull. Right? Inion and nasion. Remember that. So next, what is acromion? Acromion we have already seen in the shoulder, right? What is dens? Dens is nothing but it is odontoid process. Odontoid process which present in the, especially in the C2 vertebra. Okay. There is a projection called odontoid process that is otherwise called dens. Clear? Okay. So according to this question, the correct answer is inion, otherwise called external occipital protuberance. Okay. That's all about today's session. Thank you so much. We will post more questions till the exams are going to complete. And after that also we will continue. Please follow our channel. Thank you all.